Most common questions that I encounter: how will we prevent breast cancer and how can we detect it early? The things that we can do to prevent breast cancer are quite easy and quite common. We should maintain a healthy diet which is nutritious and balanced. We should exercise regularly. We should have regular checkups with our gynecologist or with an oncologist. We should avoid hormone replacement therapy. If you are a woman who is in her postmenopausal phase of life, we should try to avoid hormonal replacement therapies, especially those containing estrogen. Of course, as we all know, we should not smoke and we should not consume alcohol, as these are all components that contribute to the incidence of breast cancer. Now, coming to early detection, you may have all heard of mammograms. Mammograms are not for everyone. Mammograms are recommended above the age of 40 as an optional requirement in women who have a suspicious lump or who have family history of breast cancer. But above the age of 45, it is mandatory to have a mammogram once a year up to the age of 55. If you are above the age of 55, you should get a mammogram once in 2 years. But even more important than this is the concept of breast self-examination. All women above the age of 20 should undergo a breast self-examination, which is where they examine their own breasts, ideally 2 to 3 days after their periods, ideally again after a shower when the surface of their breasts and their hands are wet, using the tips of their fingers and examining both the breasts in front of a mirror and also both the armpits. By doing these simple steps, we not only increase the chances of preventing breast cancer, but we also increase the chances of early detection of breast cancer, thereby making the treatment easier and a much higher chance of a complete cure. Mashkoor jiddan, ma salam.